What concerns me is that this lump is very soft here, that's just liquid content, but up above here is quite this solid structures. Now, that solid area could be tumour based, or it could be something like a prolapse and be. Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue. Sorry, so what is her name again? I'm losing my brain today.
It's
Latte. Latte. I'm going to put this in here, Latte. Because Latte had a very large swelling down here in the abdomen. And her owner then jumped into our group and were able to make contact and able to get her to get the vet to drain that. Yeah. So when she drained it, did she measure how much came out?
I didn't notice the size of the syringes, but there were about 5
a number of them. Yeah,
syringes.
I'd have thought there would have been like 60, 70 mil in there
I wouldn't be surprised
from the
if it was
photos.
that.
Yeah.
Second time around was 2 large syringes.
Yeah.
So,
Okay, so she's had it done twice,
yes.
and it's continuing to come up. Have they done any scans or anything like that?
Not yet, no.
Okay. Because it could very well be that she's had I know it's a bit sore, Missy. The feeling of these lumps that's in here is a little bit like intestinal area, and I'm wondering if she's had a prolapse through into that area. An ultrasound would actually give a clearer indication of that. She's on antibiotics. Which ones have they got her on at the moment?
Oh, I can't recall the name of them.
Yeah.
I'm sorry.
Okay.
If it's even on the label, it was decanted into a small container for me.
Right, okay. When does that run out?
Probably in a few days.
Okay, so what have they said to you to do?
Antibiotics for 10 days.
Yep.
I've got another appointment this coming Thursday.
Okay.
To check on her progress.
Okay, yep.
And then we'll work out what to do from there.
Okay, so the colour of what came out, they had separate syringes.
Yeah.
Predominantly, was it liquidy and red, or was it pussy?
It was predominantly red.
Right, okay.
And towards the end, you could see that there was some pus in the blood, but mostly red.
Right,
So it was just milkier towards the end.
right. So there was a bit of pus coming out of there. Okay, because what I can feel with her is that there is infection there. Her body temperature localized is much warmer. So we tell a guinea pig's temperature by holding a part of their body, their skin. So if I'm holding her ear, for example, it feels just like I do. And that's because their body temperature is virtually the same as ours. It's like 0.2 of a difference. So when we hold them, they feel the same as us. So this feels completely normal. However, down here, when I feel, not so much here, but in the side area, it's very, very warm, very warm. So infection is brewing in there. And is it only one antibiotic they're giving?
Yes. As far as I'm aware. Yeah.
Okay. It feels to me like she could even have a potential stone there in the ureter coming down. It's not high, but there is a solid structure just up here where my finger is. I can feel it there. What is... Oh no, sorry darling. Sorry, let me look here. I'm just looking at the sort of discharge that she's making. I know, I'm just feeling it. She's going, oh, don't touch that. So because she knows I've got a lumpy, hard, solid bit, which does feel very possibly stone-like. So It's higher. This is the ureter that comes down from the bladder. The bladder's sort of tucked in here where my finger is. And then you've got this ureter coming down and it's sort of halfway along. And she's sort of tentatively squeaking, letting me know.
Yeah.
What's her discharge like? Because she's got brown feet. Has she had diarrhea recently? Or
she's mostly outside in a patch under a berry cane.
Yeah.
Lots of hay.
Okay.
So maybe her foot has poked through or stepped on her own poop.
And see how she's got lots of matter stuck on her feet?
Yeah, she doesn't normally have that.
Yeah, that's typical, and it matches what's actually here. So she's been urinating it out.
Oh, there you go.
Or pooping it out. Oh, there we go. We're doing a lovely wee for everyone. There we go. You needed to do that, little girl. That's all right. Urinating's a good thing because it actually helps move stones down. It does.
Oh.
Yeah.
Well, she just weed 3 minutes ago. Is that normal?
Yeah, quite. Considering how I'm touching here, yes. Quite normal, and that's a very good example of it coming out of the anus and not the peristaltic sac, which we call it the anal sac or the peristaltic sac, depending on which vet or who you're listening to. But what concerns me is that this lump is very soft here, that's just liquid content, but up above here is quite this solid structures. Now, that solid area could be tumour based, or it could be something like a prolapse and be something like intestinal based. I would tend to think perhaps more tumour based.
Those lumps seem to have grown a little bit, become
more solid.
Yeah.
But have her poops become solid as well? More solid? Has that changed?
So I don't think they've changed.
The only reason I'm sort of feeling one here that is identical to the size of that.
Oh, okay.
And if it is intestinal, they have a thing called the peristaltic movement that is what creates that shape. And yeah, I don't know if that's movable. I'm not feeling it moving at all. I know, it's very nasty. Okay, so in terms of where to go from here, she's going back to see the vet. She does need to be on an antibiotic, and that warmth is telling me that they're not on top of the infection. Really, they need to know what is causing that lump down there. Infection in that area generally results from like a bite or a nip or something intruding into that area from the outside, but she has no scarring or mark that that's happened, which makes me think it's more along the lines of maybe a tumour that's growing and interfering with that area, or maybe a prolapse of some sort, in which case you've sort of got organs that have shifted a little bit. Typically in that area, when we see that it's more common in males, not so much females. She has nothing underneath the teat, which usually when there is we get cancer around this area, you typically find it in and under here. So this is more directly in the midline area of the abdomen, and you can feel it very distinctly here. So having had the pressure relieved, that's the main thing. Because the night you contacted us, it was really huge, and the issue there is if it ruptures inwards, it then is certain death. We've had cases of that in the past where people have had guinea pigs and things have ruptured internally, and it's very difficult at that point to save them. Whereas having relieved that pressure, and if it also ruptures again, it's more likely to go outward because of the needle aspiration that they used. It's like, think of it like a balloon with a little tiny hole that was on one side. So if there's pressure building up, that's going to be the weakest point. So again, outwards, which is good. Surgical intervention could be done. Like the vet could, have they mentioned that, taking it away?
But It seemed like a very poor choice because of her age.
Her age at 7, it is challenging.
Yeah.
I think what I would be inclined to do is, if they can take an X-ray, we would be able to identify that lump that I can feel possibly as a stone that's there, but they may also see more around what is occurring, because on guinea pigs, even though X-rays are used for bones, it actually shows up a lot of things. Like when we're looking for bloat, it actually shows on the X-ray. So for them, it may give enough information, and it can be done quickly, and then we can have answers.
Yeah.
So given that she's 7, you know, you may not want to look at surgery as an option, and that's perfectly fine because she is an older girl. The thing that is important is the infection, to be on top of that, and it might mean doubling up with a different antibiotic. The other thing could be making sure that if it does get to that same size again, that it's just aspirated and lowered, and you just manage her. Pain is something that we consider with piggies enormously, and
Can you tell whether she's in pain?
to touch that area, it's uncomfortable to her, but I wouldn't say painful. But that's not to say that in a month or 2 months it won't become that way. Like when you first contacted me, it was definitely distressing her because it was enormous down here. But this is really quite flat, and there is an abdominal. You've got me again. See the colour of that when it came out as well was very whitish.
Yes.
And that's, oh no, sweetie pie, I'm sorry. Is that stressing you being there? Let's move you up. Okay. Let's move you up that way. Is that better? Okay. All right. So that colouring also matches a lump, a stone. So in the sense that I can feel something there, but that second urination was quite white in colour. That's the level of calcification that sort of comes away. Just calcium in the urine.
So is she am I giving her too much dandelion, milk thistle? Is that what's causing it? Because she's getting timothy, ocean hay and grass,
Okay.
as well as those 2 weeds.
They're fantastic. They're full of nutrients. They're really, really good.
Yeah.
I would perhaps lower the dandelion a bit because they can be very high in calcium, and just go more broadly with grasses. Try that. It won't change a stone if it's already there.
Yeah.
What we hope with females is that they can urinate them, and we can then take them out. Like when we remove them, that's them.
Oh.
They are a stone. So when we take them out, but they need to be further down the ureter than that is. So I think for now, the best thing you could do is monitor her. She's already being overseen with antibiotics and the vet. We look at keeping that area in check. I'd like to be able to say that when you touch it, there's no warmth. That means infection is gone. Because a cancerous tumour is not infection. It doesn't actually feel warm. So that's what I'd like to see. And if it were to rebuild to that level, definitely have that drawn off again. We can do that here, or we can leave that. It's not at the stage where you do it now. It's not an issue right now for her. It's developing. And go with that plan. So it's sort of more a case of watch and see, but if we can get an X-ray, that will tell us a whole lot more about what's going on there. Because if there is a big stone, it really changes prognosis and everything. So we'll go from there. Yeah, you're very cute. She's really sweet. She is.
She kissed you a few times.
Yeah, she did. She gave me some kisses. She's beautiful.
She's very affectionate.
Yeah, she's lovely. So hopefully that will help. Yeah, because what is disturbing, and the other thing that's disturbing is the fact that it's in separate bumps in this area. She does not like that being messed. Sorry. But it's interesting, she'll poop and wee when you touch there, but it is applying pressure near the bladder area. That lump I can feel is still there. It's the same size as one of these poops. It hasn't moved. So in that sense, because if you think of them like a little train of poops being made to come out, they should move if it were that. That's what I'm going on feel. but it should actually move, and it's still there, still showing. And there's one there, more of a mass here, and in, yeah, it's just deeper in under there. So I think you're on the right track. She's way, way better than she was, but I think we need a little bit more to do with the antibiotics. I don't think they should finish in 10 days, and if anything, I think there should maybe be a doubling up of antibiotics because there's warmth. So when you point that out to the vet, when you go back, that you can feel the body temperature's localised and warm, he will then look at that and say, look, let's continue this for another 10 days or so and go from there. Okay? All right, thanks Elaine for bringing her up.